I'm Dr. Brian Wind, Clinical Director of the Sleep Centers of Middle Tennessee. Each year, millions of Americans suffer from sleep problems. Some sleep problems are mild or temporary and are relatively easily resolved. In many cases, sleep problems are more serious and require professional help. Referral to a sleep disorder center may be beneficial in these cases. The Sleep Centers of Middle Tennessee are accredited sleep disorder centers employing board-certified professionals who specialize in the practice of sleep disorders medicine. You can be assured that the care provided at the Sleep Centers of Middle Tennessee will be outstanding. Our sleep specialists are highly trained to make accurate sleep disorder diagnoses, and top-notch care is provided to treat the full range of sleep disorders. The first step in our evaluation process at the Sleep Centers of Middle Tennessee is a consultation appointment. This appointment may be made by your doctor, or patients may call to make the consultation appointment themselves. Our organization accepts most of the major insurances. At your consultation appointment, you will meet with our clinical staff, including your sleep doctor. Thorough sleep and medical histories will be taken. This information is used to help us determine what your sleep disorder diagnosis may be. Some sleep disorders are diagnosed by information gathered in the consultation appointment alone. Other sleep disorders are diagnosed by a sleep study, which involves sleeping in one of our sleep laboratory rooms for at least one night. Your consultation appointment will conclude with a thorough educational session about sleep disorders and about our evaluation and treatment processes. If an overnight sleep study is required, this will be scheduled at the conclusion of your consultation appointment. Some sleep disorders are diagnosed by an overnight sleep study. One of the most common sleep disorders diagnosed by a sleep study is obstructive sleep apnea, a disorder in which a person has stoppages in breathing or significant reductions in breathing during sleep. Based on information gathered as part of the consultation appointment, patients suspected of having obstructive sleep apnea are usually required to undergo at least one sleep study. On the night of your sleep study, our sleep center staff will greet you and show you to your sleep laboratory room, which is designed to have all of the comforts of a nicely furnished hotel room. The staff will also walk you through the process of how a sleep study is conducted. You will be hooked up to some wires and electrodes, none of which are painful. Your sleep doctor may be able to provide you with medication to help you get to sleep if needed. Once asleep, our staff is busy monitoring multiple physiological characteristics of your sleep. The information gathered during the sleep study is helpful to your sleep doctor in determining your exact sleep disorder diagnosis. For patients being evaluated for obstructive sleep apnea who exhibit severe apnea in the first few hours of the sleep study, a treatment for sleep apnea known as PAP, positive airway pressure, is often initiated during the second half of the night. For other patients, a second sleep study will be required to initiate treatment. At the conclusion of your sleep study, the staff will unhook you from the equipment, and you are free to leave soon after your wake-up time. Our sleep laboratory rooms are each equipped with their own private bathroom so that our patients may get ready for their day before leaving the sleep laboratory if they so choose. For patients requiring a sleep study, a follow-up appointment in our sleep clinic is conducted soon after the sleep study. At this appointment, the results of the sleep study are reviewed in detail, and further education is provided regarding your specific sleep disorder diagnosis. Treatment options will also be discussed in detail. Depending on the nature and severity of your sleep disorder, a second sleep study may be required to initiate treatment. For patients not required to undergo a sleep study, follow-up appointments are scheduled in our sleep clinic according to your diagnosis and treatment needs. Patients suffering from insomnia, for example, need not have a sleep study. Follow-up appointments will continue to be scheduled on a regular basis until such time that your sleep disorder is effectively treated.
Well, thank you so much for bearing with me through all of that. It was a pleasure to meet you. I'm glad you came in, and we'll get you scheduled and on your way here in just a second. Right. Okay, thank you.
At the Sleep Centers of Middle Tennessee, our highly trained staff are experts in the diagnosis and treatment of sleep disorders, and our patients frequently experience significant improvement in their quality of life and their health as a result of their experience at our facilities. Please ask your doctor how to obtain help for your sleep problems, or feel free to contact us directly at the Sleep Centers of Middle Tennessee. In the meantime, pleasant dreams.